Hello, welcome to BBC News, broadcasting to our viewers in the UK and around the world. My name is Sarah Johnson. Dental amalgam, a mixture of mercury with at least one other metal, is the most commonly used dental restorative material used for dental fillings. Amalgam has been the restorative method of choice for many years due to its low cost, ease of application, strength, and durability. However, due to many concerns regarding health effects, aesthetics, and environmental pollution, scientists have been trying to find an alternative to this filling material. A year ago, in 1973, glass ionomer cement was developed by Wilson in Kent in England. To expand on this subject is Golara Farhoomand.
Glass ionomer cements are becoming quite popular due to their physical and mechanical properties and their clinical performances. These materials are formed when glass powder, usually calcium or strontium aluminofluorosilicate, is mixed with an aqueous solution of polyacrylic acid, a polymer of acrylic acid with a pH of maximum 3, which in dentistry usually a concentration of 40 to 50% is used. These two components, when blended together, undergo a hardening reaction involving neutralization of the powder glass base and the polyacrylic acid. After the cement has been mixed, the hydrogen on the carboxyl group of the polyacrylic acid is progressively replaced by calcium, aluminum, and fluorine, which was extracted from the glass particles, and as a result, calcium, aluminum, and fluorine ions are released. Setting and hardening result from the cross-linking of the polyacrylate chains by these ions. The fluorine that is released by the reaction is useful for preventing tooth decay that cause cavities. Bacteria in a person's mouth convert carbohydrates into acids such as lactic acid through a process called fermentation. If left in contact with the tooth, these acids may cause demineralization, which is the dissolution of its mineral content through the reaction between hydroxyapatite, the principal constituent of tooth enamel, and the acid such as lactic acid, forming water and solvated ions. To help prevent acid from damaging tooth enamel, many wastewater treatment plants add a small concentration of salts such as sodium fluoride, a basic salt that is somewhat soluble to the water. Toothpaste that contain fluoride salts are also helpful in preventing tooth cavities. Fluoride ions are able to displace hydroxide ion from hydroxyapatite. The fluoride ion is a much weaker base than the hydroxide ion, and fluoroapatite is therefore less reactive towards acids. Since glass ionomer has the ability to release fluorine during the acid-base reaction, and therefore acts as a preventer of cavity, they are more advantageous compared to amalgam. However, fluoride release decreases over time. Usually it lasts in about 3 months after treatment. Laboratory studies have shown that glass ionomer materials can have their fluoride recharged with topical fluoride treatment. The result is a significant increase in fluoride release by old glass ionomer materials. Amalgam bonds to teeth mechanically. That means it fills the space and grooves that are placed by the dentist. On the other hand, glass ionomer cement bonds chemically to the tooth structure. The mechanism of bonding involves an ionic interaction between carboxyl group of polyacrylic acid, which has a high electronegativity, and calcium or phosphate ions from the surface of the enamel or dentin, which has lower electronegativity. The bond to dentin may also be a hydrogen bond type of adhesion to the collagen. The ionic bond also accounts for the characteristic of glass ionomer cement, which is hard but brittle. The bond strength, as measured in shear bond strength test, is not particularly strong. It is almost 2 to 7 megapascal. However, clinical experience would indicate that it is durable when the material is used for restoration of erosion lesion. Bonding is more effective when a clean tooth surface is provided. Treating dentin with an acidic conditioner followed by a dilute solution of ferric chloride also improves the bonding. The cleansing agent removes the smear layer of dentin while the ferrous ions are deposited and increase the ionic interaction between cement and dentin. These characteristics make glass ionomer cement a much more suitable filling material for dental purposes.
That was it for this segment. Thank you for watching.